Well, if you work in the medical field, some of you may already have been challenged by the assisted dying legislation that was passed earlier this year. Maggie is here with her guest to bring us an update.
Larry Worthen is the executive director of the Christian Medical and Dental Society, and he is also part of the leadership team for the Coalition for Healthcare and Conscience, which is doing everything in its power to protect and advocate for doctors who feel that participating in Canada's newly passed medically assisted dying process would go against their conscience and faith values. Thanks for joining us, Larry.
My pleasure.
So first of all, tell us about this coalition.
Well, it's a coalition of 10 different organizations, all from Christian background, that have banded together for three main reasons. One, to express our concerns about the legalization of assisted suicide in Canada, but also to talk about conscience protection for individual caregivers and also for facilities that might be forced to provide medical assistance in dying on their premises.
And you've heard from some doctors who have been asked by patients to help them end their lives. And what are they saying?
Well, the doctors are extremely anxious at this point because the College of Physicians and Surgeons of Ontario has a policy which requires them to provide an effective referral for patients who request assisted suicide or euthanasia. For these doctors, a referral is essentially the same as a recommendation. Morally, they cannot allow themselves to participate in this. And their concern is that if they are reported to the college, they could be disciplined up to the point of losing their ability to practice medicine.
So you, along with 5 doctors and 3 other organizations, or 2 other organizations, have started legal action right here in Ontario. Tell us about this.
Well, we've gone to the district court to ask for judicial review. We feel that this college policy is actually infringing our freedom of conscience and freedom of religion. And it appears to us to be a totalitarian type action designed to discriminate against physicians of conscience and basically to try to eliminate them from the practice of medicine.
Now, we're talking about Ontario. What have you seen across the rest of the provinces?
The other English-speaking provinces have provided workarounds or accommodations to allow doctors who have conscience concerns to continue to practice medicine. Quebec is a little different, but we are also concerned about that province in that they require a conscientiously objecting physician to provide information and referral to a hospital administrator. But Ontario is really the province of greatest concern. No other college has a policy that is as restrictive as Ontario's.
And I know that you were here recently in Ontario speaking to MPPs. What have they been saying about this?
Well, the interesting thing is that most of the MPPs we speak to are supporting us. They can't understand why the college has taken this draconian measure. We have strong support in both the NDP and Conservative parties who've gone on record as supporting us, and also amongst many cabinet ministers and backbenchers. They've expressed support for our position as well. So we're kind of left scratching our head why the government of Ontario has not developed some kind of accommodation or workaround that would allow our doctors to continue to practice without the fear of losing their license.
There's also some concern with senior residences as well in Ontario. Tell us about that.
Well, the government of Ontario came out and said that hospitals would not be required to provide medical assistance in dying if they were faith-based institutions. But our understanding is, as of yet, they have not come out and categorically said that all faith-based institutions, like nursing homes and hospices, would be exempt from providing medical aid in dying on their premises. We understand from groups like the Salvation Army, the Catholic facilities, Mennonite facilities, and other Christian denominations are extremely concerned about this and have indicated that they would be forced to close down before they could follow a government requirement that they permit assistance in dying on their premises.
So they're still waiting for clarification from the government as to what the next step will be. So what does that mean for today? If somebody wanted to have a medically assisted death in a senior residence or a hospital today, and it's a Christian-run organization, would that organization have to actually do this?
Well, our position on this is that organizations, individuals are protected under Section 2 of the Charter of Rights and Freedoms, which guarantees us freedom of conscience and freedom of religion. We believe that any action that might be taken by the Ontario government or the action that has been taken by the College of Physicians and Surgeons is illegal. It's unconstitutional. It goes against the Constitution of Canada. So we really feel it's important now for all Christians to band together to try to send a strong message to government that this is just not acceptable.
But I guess, Larry, my question is, what is happening today? If somebody were to, want to actually die through medically assisted death, and they're in a Christian facility, would that organization actually have to follow through?
In my opinion, no.
Okay.
And what these facilities have all offered is a complete transfer of care to another facility that allows assisted suicide or euthanasia.
Okay, so what you're essentially saying is that by having this legal action, you want to move that outside of the premises. That's exactly what you're saying.
Yeah, the legal action is right now is dealing specifically with physicians, doctors who are, who a patient may come into their office, may ask for assisted suicide or euthanasia. The doctor's comfortable talking with them about it, having the discussion and talking about all the options. The doctor just not want to be morally implicated by being forced to refer, to make a recommendation for this to another doctor. That's currently the policy of the College of Physicians. So the legal action is really against the College of Physicians, and it's dealing with individual doctors. The issue around facilities is the jury is still out on that because we're waiting to hear back to get definitive word from the Ministry of Health and Long-Term Care as to whether they're going to require this or whether facilities are going to be able to just basically transfer patients. What's happening right now is they are conscientiously objecting facilities are transferring patients, but they're just concerned that the government may stop that practice.
I only have seconds left. Larry, what can Canadians do?
Well, we want everyone to go to our website, Canadians for Conscience. We need people to sign up there, put their emails down, and send letters to their politicians all across Canada, basically supporting our right to conscience protection. Christians have to stand together. We have to stand up against this. Otherwise, Christian healthcare is in jeopardy.
Thank you very much, Larry Worthen.
Thanks very much, Meg. I appreciate the time.